What's going on YouTube? It's DJ Expect back with another video. This video I'm going over med calculations. Very easy concept. I'm gonna get right to the point so you can get to how to do med calculations really fast, really quick. Just one thing to know if you're a nursing student, med calculations is very important. I work in pediatrics. I work in pediatrics for about 5-6 years now, and literally every medication I give to my patient is calculated 3 times. One by the doctor who puts in the order. He has to make sure he's giving me the right order. Second, the pharmacist, before she can approve it and give it to me, she has to do her med calculation, making sure it's done. And then lastly, myself, before I give the patient the medication, I have to make sure the meds is calculated correctly. I never, in my years of working, I only came over with an error once, and it was an emergent med. The doctor and the pharmacy didn't check the med properly before they gave it to me, and then I was able to catch the error before I gave it to the patient. But it was an emergent med. Literally, between the time the doctor put it in to the time I got the approval, it was less than like maybe 2 minutes. So yeah, it was very quick and it was an error. I can't remember what the med was and if it was a detrimental thing, but if it was a detrimental thing, that could cause patient harm. And ultimately, I think I would have got fired if I gave the patient the med, and maybe the doctor and the pharmacist may got but I most likely would have got fired. So med errors are definitely something you don't want to have happen, and med calculations are very important. So first things first, whenever you start with a med calculation, you always want to start out with the dose. What is the doctor ordering? Right here. What is the doctor ordering? So you start off with the patient dose. I like the cross multiply method. To me, it's the most easiest method. I don't even know any other method. The first time I learned this, I literally use this every other time. And it's worked for me, it's never failed. So yes, the patient's dose is the first thing I always start with. And with cross multiplying, you're always trying to make sure the units match up. And in between, before you get to your solution, first is what's supplied. Then it could be the weight-based dose, and it could be any conversion that happens in between before you get your final conversion. And then the last part of the equation is what do you have to give the patient, whether it's milliliters, milligrams, whatever. I just wrote milligrams here as an example, but at the end is whatever that's what you need to give the patient. So let's begin. You'll understand it more as I go through some examples. So first things first, I'm going to first go out with the long way, and then by the time we maybe do 3 or 4 problems, I'll show you the fast way and how I get to the problem quick. Because like I said, I work in pediatrics and I'm working in the ER. So my med calculations have to happen like pretty quickly. So yeah, so we'll start off slowly and I'll show you how to get these things done. So like I said, first thing you start with the order. And this first problem, straight to the point. MD writes the order for Tylenol, 160 milligrams. Start with my first cross multiplying bar. As needed every 6 hours for pain in her child. Pharmacy dispenses you with 80 milligrams per milliliter. How many milliliter will you have to administer per dose? So this question is full with a lot of BS. Basically, the way I understand like what I need to end up with is what am I given and what do I have to give. Right here, I'm ordered to give 160 milligrams, but I have to give it in milliliters. So I write milliliters right here at the end. This every 6 hours didn't ask me how many milliliters per hour. It didn't ask me any of that. So I don't need to know this hour part. I can just cross that out. So that's BS. That's the part that they like to trick you up on. So now the second part of my bar is going to be this part. This part is going to be what am I given? So when you pick up Tylenol in a store, you might not notice it, but it will say there somewhere on the box, 80 milligrams per milliliter. So we're cross multiplying. Remember, our units have to match up. So you write 80 milligrams at the bottom and milliliter up top. And we have to end up with milliliter. And per means 1. In math terms, per always means 1. So 80 milligrams per 1 ml is our problem. So now we just simply do the math. This one's an easy math. This one doesn't need a calculator. So basically 160 divided by 80. If you know your multiplications, 8 times 8, 16 times, that's basically 2. But 160 divided by 80 equals 2. And again, not to cut any steps, but let's cross multiply. Let's get rid of our milligrams. Or our problem, the way we want our problem to look like in the end of the day is we want nothing but numbers in 1 or 2 units at minimum, depending on what our answer needs to be. For these ones, it's just 1 unit at the end. So 1 unit at the end, all numbers, 1 unit in the problem. So like I said, 160 times 1 is 160 divided by 160. Let's do it again. 160 times 1 is 160 divided by 80. Divided by 80 is 2. So the answer is 2. Here's the answer right there. The next question. I'm going to try not to skip any. I skipped too many steps because I'm so used to doing this problem like so fast that I got to remember to slow it down for you guys. So let's try it again, and I'm going to try to do it again slowly. MD writes an order for Mucimus, 300 milligrams by mouth, 1 dose before heart cath. Pharmacy dispenses you 600 milligrams and 2 mLs. How many mLs would you administer per dose? Again, what's our order is what we start off with. Our order is 300 milligrams. And then we start our first bar. 1 dose before heart cath. Our problem is how many mLs will we administer per dose. Doesn't say nothing about 1 dose. Doesn't say nothing about doses. Doesn't say nothing about heart cath or any of that. So don't even worry about that. It's BS. Granted, there's no math you can do for that anyway, but it's BS. Pharmacy dispenses you. Basically, the second part of the problem is going to be what are you given? What are your options? What is available to you? What's available to you is you have 600 milligrams of Mucimus in every 2 mLs. So write 600 milligrams at the bottom, 2 mLs up top. And we have to end up with milliliters. So put milliliters at the end. So now let's cross multiply. Let's see, do we have only milliliters left in our problem? We do. Only milliliters left in numbers. So now we can solve our problem. So 300 times 2 is 600 divided by 600 is equal to 1 ml. 1 ml. So we write 1 ml here. Next question is MD writes an order for ibuprofen 3 milligrams per kilogram by mouth every 6 hours for a child. The child weighs 173 milligrams. Pharmacy dispenses you with 50 milligrams per 2 mLs. How many mLs would you administer per dose? So for this problem, now this is what I'm used to. Working with children and working with meta calculations with more than one step. So this problem has a couple steps in it, which is perfect. Again, I've never saw these questions before. These questions are from registernursrn.com. So I've never seen these questions before. So I'm going along with them as I'm doing them with you. So MD writes an order for 3 milligrams. So I'm going to work it along with you. So MD writes an order for 3 milligrams per kilogram. Because the order now has a second unit, kilogram, you're going to write that at the bottom. 3 milligrams per, remember per means 1, per kilogram, given every 6 hours for pain. That every 6 hours, again, look at our solution. Look at our final answer. Does it say anything about our hours? No. So that's BS. Take that out. The child weighs 73 kilograms. That's important because, again, our problem is in kilograms. So we're going to need that child's weight because we're given 3 milligrams per kilogram of that child's weight. Let me erase that. So, So we're going to need that. So keep that there. The pharmacy dispenses you 50 milligrams per 2 mLs. How many mLs would you administer? Let me move this over. Hopefully I have enough room, but let's try and work this out together. So again, easiest way, put our solution at the end. How many milliliters do we need? That's what our goal is. So the way I like to do these problems when it comes to weights is I like to do my dispensing, what I have available to me in the medication first. So 50 milligrams and 2 mLs. Let's do that. 50 milligrams, 2 mLs. So we'll cross multiplying again. Milligrams is right here. Let's make it a little. Milligrams is right here. So let's put that at the bottom. 50 milligrams per 2 ml. 2 ml. All right. Now times. Now this is where the child's weight comes in. Because again, we're given 3 milligrams per kilogram. Per kilogram means per the child's, every kilogram the child weighs. Is how much Motrin we're given, which is ibuprofen. So let's do. So, but kilogram, this is in pounds. But do we all know how to convert kilograms to pounds, or from pounds to kilograms? It's basically 2.2. So we can put 2.2 up top, because for every, or I like to put 2.2 at the bottom. Hold on, I'm checking myself up. 2.2 pounds. There you go. 2.2 pounds equals 1 kilogram. There you go. Almost tricked myself up. So basically, what I'm gonna do is I'm gonna put the kilograms up top because for every 1 kilogram, we will have 2.2 pounds. Do you see what I did there? Let me explain it one more time. Because our answer has to be in kilograms, because that's what our medications order, 3 milligrams in every kilogram. And our child's given is 73 pounds, which actually that's not even a child anymore, it's an adult, because that's like 130, 40, 50 pounds right there. So that's basically an adult, whatever. So for every kilogram equals 2.2 pounds. So we can convert this before we put it in our problem, but I like to put it all in one thing so I know I'm not missing anything or I'm not skipping any steps. So 1 kilogram equals 2.2 pounds. Now we can put in the child's weight. Child's weight is 73 pounds. We put 73 pounds up top because we're cross multiplying. 73 there, 73 there, and this is pounds. And for a child, I like to represent a child as a little person. And that's it. And I believe that's it. But let's cross multiply just to make sure we got everything covered. Milligram, milligram. Kilogram, kilogram. Pound, pound. Milliliter is our total. And the person is basically saying that I'm given that much milliliters. I'm given this many milliliters for this one person. So you can keep the person there. The person's not really a factor. So now let's do our math. This one's going to be, this one, you would need a calculator for this. I mean, you could do it physically, but at work myself, I use a calculator. I'm not sure, I've been in nurse school in like 7 years. I believe in nurse school I was able to use a calculator for this. So I can't remember, but if not, this is math you could do. But we're not going to do that. We're just going to use a calculator. So 3 times 2. 3 times 2 is 6. Times 1 is 6. Times 73. Times 73. 438. 438. Over. Now 50 times 2.2. That's all we have at the bottom. 50 times 2.2. That's 110. So now 438 divided by 110. And then we'll find out our milliliters. 438 divided by 110. 3.98 is my answer. But if they've taught you yet in school, when it comes to giving medications, you always want to round down. You never want to give the patient too much. You can always give the patient too little, but you never want to give them too much. So we're going to round down. It's going to be 3.9, which is our answer right here. Let's see how many problems are left. We're not going to do all 10 because I think you pretty much get the idea of it. When it gets more complicated, don't even worry about it. Again, just remember what's the dose and what do I have to give. That is it. Anything else can be solved in between by cross multiplying. And cross multiplying is also the same thing at the bottom. I didn't explain that here. But cross multiplying, here's the bottom, here's the top. Here's the bottom, here's the top. Here's the bottom, here's the top. That's how cross multiplying works. All right, let's do one more problem. MD writes an order for lactulose, 20 milligrams by mouth twice a day. Pharmacy dispenses you 10 milligrams per 15 mLs. How many mLs will you administer per dose? So, what do we start off with what's given. Now let's skip some steps. Hopefully y'all are with me and y'all get where I'm going with this. All right, order is 20 grams. And we're going to give how many mLs? That's what we end up with. We have 10 grams per 15 mLs. All right, let's do the math. 20 times 15. Divided by 10. And that equals 30. 30 milliliters per dose. Simple. So I don't think I'm going to go any further because I think I pretty much was able to go over, again, what you start off with is the ordered and what you have to give is your answer. Look at the last one. No, it's the same thing. Pretty easy. Okay, so we're pretty much good. Um, um, I'm gonna look at some more problems, see if I can find some more questions for you guys. But if there's no other questions, and if you think you understand it, please give a thumbs up. I'm kind of sick. I'm still new to this YouTube game, so my videos are not perfect yet. But I'm working on it. But I hope you enjoyed. Hopefully, make it easy because it is so easy once you get the hang of it and find a method that works for you. This is a cross multiplying method. To me, works the best. This works the easiest, and this I can do on the fly. All right. Good luck, guys. If there are any questions, send me a message. Comment, subscribe. Check out my other videos. All right. Till next time.